So welcome everybody. My name is Jocelyn Rodriguez. I hope that you are all here to learn about resources for the uninsured population, especially that related to healthcare. And so we're going to go ahead and start. As people come in, feel free to also include any questions as mentioned in the chat. But thank you so much for connecting, and please keep your microphones on mute. Okay, so thank you so much, everybody, for connecting. I know that it has been a crazy summer, and so I appreciate your time for learning a little bit more about what are the resources for the population that is uninsured. So many does not have insurance, and how can they access healthcare resources, especially in Maryland? So my name is Jocelyn Rodriguez. I'm the founder and CEO of Coaching Salud Holística, which means coaching holistic health. And we truly believe in accessing healthcare resources is so important for everybody, regardless of immigration status, language, or where they live. And so we're very excited to be here today to talk about, how can we access those resources for the individuals who are not able to get maybe Medicaid or Medicare or any other type of commercial insurance. So please give us a follow on your favorite social media apps. We are in quite a bit of them, as you see. We're also on YouTube, where we're always uploading a lot of our webinars regarding resources. Like today, today's session is going to be uploaded onto our YouTube page. And so just to know about, of our upcoming resources or events like health fairs, food distributions in your areas, please follow us on social media. We're constantly posting them, and we'll share a little bit more about, where you can find additional resources through us later today. So thank you so much. And so I want to hand it off to Patricia from the Maryland Insurance Administration, who's going to share a little bit of, some exciting news and also the resources and services that they provide. So welcome, Patricia. You have access now to share your screen.
Hi, Jocelyn. Hi, everyone. My name is Patricia Dorn, and I'm with the Maryland Insurance Administration HCAT team. That's the Health Coverage Assistance Team. We are an entity that you can reach out to if you have health insurance related questions. I'm going to go ahead and share my presentation. If you have questions as I'm speaking, you can go ahead and you can put them in the chat. And I'll also give you an opportunity to ask some questions when I am done with the presentation. Jocelyn, and my slides show up okay? So we're going to talk about health insurance options for Maryland's immigrant community members today. And I just want to make it clear that we're talking about health insurance options. I won't be going into any details about things like the federally qualified health centers, which can offer sliding scale care and in some cases free care. I won't be going into those options. This is a focus on health insurance and those options. If you do want to jot down my email address, it's patricia.dorn@maryland.gov. You can always reach out to me, send me a question. Again, I represent the HCAT team. We are here to answer health insurance related questions for Marylanders. And if you shoot me an email, that will become part of our cases. Just so you know, this presentation does not, let me go back to that. Does not, yep, sorry guys. Does not provide legal advice, and you should discuss specific questions with your trusted financial advisor or insurance producer. It's just kind of a disclaimer that we have to use for our presentations. All right, before I get into this, I do want you to understand who the Maryland Insurance Administration is, what we do, and why I'm here talking to you right now. So the Maryland Insurance Administration is a Maryland state agency, and we are the entity that enforces the insurance laws in Maryland. And we also make sure that the agents and the brokers that sell insurance products in Maryland follow the laws. So we are the entity that you can go to if you have an insurance problem, or if you have a problem with an insurance agent or broker in the state of Maryland. So we make sure that the companies that operate in the state of Maryland follow the laws and that they follow the policies that they've issued to you. So you can always reach out to us when you have insurance problems or insurance related questions. We're here to talk about health insurance today, but that's also for your auto insurance, homeowners insurance, renters insurance, life insurance. We regulate the industry, the insurance industry. All right, so I'm going to start out with the Maryland Health Connection, the plans that are offered by private companies on the Maryland Health Connection. So to be eligible through the Maryland Health Connection, so to purchase those ACA qualified plans through the Maryland Health Connection right now in June of 2024 and through the year 2025, to be eligible to purchase, you must live in Maryland, you must be a U.S. citizen or be lawfully present, not be incarcerated, except if you are incarcerated pending disposition. All right, so currently, as it stands right now, in order to purchase health insurance from the Maryland Health Connection, you do have to meet those criteria. If you are present in the U.S. under certain immigration statuses, or if you apply for certain lawfully present statuses, you may be eligible to enroll in a private healthcare plan through the Maryland Health Connection. And again, that is Maryland's official health insurance marketplace. Okay, so this is how it stands now. We're going to talk about a new law that goes into effect in 2026, but this is the situation as it is. So if you purchase one of these plans, you do not need a Social Security number. You can apply for health coverage through the Maryland Health Connection, even if not all of your family members have an immigration status that qualifies them for coverage. Individuals who are not requesting coverage will not be asked about their immigration status. You do not need a Social Security number or an ITIN number, an individual taxpayer identification number, to apply for coverage. However, if you are requesting financial help and file taxes, you will be asked to provide your Social Security number. There's more information available from the Maryland Health Connection regarding specific immigration statuses and purchasing from the Maryland Health Connection. I do recommend checking out this site. And if we have a little bit of time at the end, I will take you to this site as well. It is a pretty useful site for understanding the details about MHC and the various immigration statuses. Marylanders, can purchase the exact same ACA compliant individual or family health insurance plans from the Maryland Health Connection Marketplace and directly from insurance companies that have those plans. So the plans are offered on the marketplace. You can purchase each one of those plans off of the marketplace directly from the company itself. So just as an example, a Care First plan that's offered at the marketplace can be purchased by calling them up directly as well. So you can buy these plans by contacting the insurance company directly online at marylandhealthconnection.gov, or you can get free help from a licensed agent or broker. So an agent or broker who is licensed in the state of Maryland. So the Maryland Insurance or the Maryland Health Connection has restrictions on its ability to sell policies to those without a legal immigration status. But the same plans can be purchased directly from the insurance companies and be sold to people without a legal immigration status. So same plans, but instead of purchasing them from the Maryland Health Connection, you're purchasing them directly from the insurance company itself. This says below, you'll find information on how to find the plans from the insurance company and information from the Maryland Health Connection. Those are on the next pages. So we list this information on our website. And it tells you who to call and what to do. So no matter what your immigration status is, you can buy the same coverage directly from the insurance company or through licensed agents and brokers throughout Maryland. So Aetna, we have the Aetna information, the website available, and the phone number. For Care First, that information, the website is available there, as well as the phone number that you can call. So again, Maryland Health Connection, you can purchase those plans, you can qualify for subsidies with an legal immigration status. However, if you do not have a legal immigration status currently, you cannot purchase plans from the Maryland Health Connection. You do need to call the companies directly to purchase the plans. Kaiser is also selling plans on the Maryland Health Connection in 2024. Their information is here, as well as United Healthcare. You can call them directly and purchase the plans without a legal immigration status. If you choose to work with an agent or a broker, which you can certainly do, we do encourage you to check and make sure that they are licensed to sell health plans in Maryland. I think it's really important, especially for people, for people who are immigrants, for people who English might not be their first language. You are more vulnerable to health insurance fraud, scams, etc. And there are plenty out there. And I think it's a really great idea if you decide not to use one of these 800 numbers to purchase the product and you decide to work with an agent or a broker. And working with an agent or a broker, they might be able to help you understand what you're purchasing. They might be able to give you, multiple options. They might be able to show you Kaiser plans and United Healthcare plans at the same time, instead of calling the companies separately. I think it is a great idea to work with an agent or a broker if you would like to. However, I just really need you to be really careful and make sure that that is a real agent or a broker, genuinely licensed to sell health insurance in the state of Maryland. And you can get that information from us, from the Maryland Insurance Administration, and you are very much encouraged to do so. All right, so now we are going to talk about Maryland's 2024 Access to Care legislation. So the Access to Care Act addresses a critical gap in health coverage for undocumented immigrants in Maryland who currently are not eligible to purchase health plans through the state's health insurance marketplace. So as we talked about earlier, currently undocumented immigrants, those without a legal status, cannot purchase through the Maryland Health Connection. They have to either call those companies directly or work with an agent or a broker who's going to purchase the product directly. Starting in 2026, this legislation will remove this barrier and allow undocumented residents to purchase and enroll in health plans through the Maryland Health Connection. So an estimated 112,400 currently uninsured Marylanders will be eligible to enroll in health coverage now through the Maryland Health Connection, and this is considered a vital step toward health equity. The undocumented immigrants will not be the subsidies that those with legal status, the tax subsidies that they can get to help them pay the premiums for health insurance, that is not part of this legislation. So the undocumented immigrants who purchase these products are essentially paying the full price of the insurance, but they can now purchase it on the Health Connection. And why that's important is that the Maryland Health Connection has navigators, and they have they have a lot of people that can help you understand what you're purchasing. And I'm not saying that the agents and the brokers and the insurance companies, when you purchase them directly, don't know what they're talking about. But what the Maryland Health Connection does is it puts all that information in one place. So each one of the navigators that is helping you make the decision has all the information for Aetna, United Healthcare, and CareFirst, and all the different companies that are offering that product. They have all that information right in front of you, so you can make easy comparisons. The enrollment process is made relatively easy. And so using and going through the portal of the Maryland Health Connection is a great way to compare plans and make sure that you are making the best decision for yourself. Not to say you can't do it by calling the companies individually, but it without a doubt is a slower and more complicated process. And so it's great to see this legislation has passed, and this legislation will go into effect in 2026. If you have questions, I can't say I can answer a ton of questions other than, about the legislation, other than what I'm telling you now. But if you do have any questions for me whatsoever, I do encourage you to utilize the chat. If you want to read the legislation, it is right here on this page. Let me just go ahead and put this link in the chat so you can capture it. Actually, that is proving to be more difficult than I thought. I'll get it in the chat for you. All right, the next thing that I'm going to talk about, continuing on with our conversation about health insurance, other options. All right, so you can buy the products that they sell from the Maryland Health Connection, or those same products that are sold off exchange. And it is what we consider comprehensive health insurance. So health insurance that covers most things. You're still going to have premiums, that amount that you pay every month. You're still going to have deductibles and copays. So you're still going to have out-of-pocket expenses, but comprehensive health insurance covers most of the health situations that you might find yourself in, up to and including prescription drug coverage. Some of the other insurance products that are out there, while legitimate health insurance products that you can purchase and they can give you some help covering the costs of your care, don't cover as much. So I'm going to just touch on those a little bit. I think how far down the rabbit hole with this information I get is going to depend on if people have questions about these products, but I'm going to at least make you aware that they exist. So the first product that I'm going to talk about for a minute is the short-term limited duration health insurance. Short-term limited duration health insurance is similar in some ways to the health insurance that they sell on the marketplace, because it is comprehensive coverage and it does give coverage for most health situations. And in most situations, it'll give you coverage for prescription drugs as well. However, with short-term limited duration coverage, it usually only covers you for 90 days. You can ask for an extension for another 90 days. And this is usually used for a bridge. So a bridge to coverage coverage. You're in one coverage situation and maybe you're only going 90 days without, and you can purchase these short-term products. If you're undocumented immigrants, you can purchase the short-term limited duration health insurance products. So they are major medical health insurance, but again, they only last for a short time. They end after 3 months. They cannot be renewed. In many situations, they can be renewed once for 90 days. The policies are designed to fill short gaps in coverage when an individual is switching from one health insurance plan to another. Example, you just retired a couple months ago before you qualified for Medicare, or you took a short break between an old and a new job. Unlike the plans that are offered on the Maryland Health Connection, you will be underwritten when you purchase a short-term limited duration health insurance plan. And what that means by underwriting is that they are going to ask you health questions and they can deny you based on the information that you give them. They can also charge you more based on the information that you give them. So they could give you the best price that they have. They could deny you completely, or they could charge you more based on your health situation. But it's just something to know that these policies are available for everyone to purchase. That said, if you're working with an agent or a broker and you're interested in one of these policies, we do encourage you to call the Maryland Insurance Administration and make sure that the agent or the broker that you're working with is licensed to sell health insurance in Maryland. And this is a real concern and a real risk. We don't want you to fall victim to a health insurance scam. So these short-term limited duration policies are not required to comply with the federal Affordable Care Act requirements. So the plans that are sold, the comprehensive plans that are sold on the exchange, they must comply with the Affordable Care Act, which means that there's certain things that they absolutely have to cover. They have to cover everything that falls under the umbrella of the Affordable Care Act. These short-term limited duration plans don't have to do that. So you do have to be really careful. You have to read your policy and understand what you're purchasing. So short-term policies not required to comply with the federal ACA requirements, although they must cover certain benefits required under Maryland state law. Because the policies do not have to comply with the ACA, the insurance company may ask health questions in your application, and the plan may contain pre-existing condition limitations, which means you told them that you have a certain condition, and these short-term plans can say, okay, we'll cover you for everything else except that condition. A pre-existing condition limitation means the policy may not cover medical expenses due to a medical condition you had before the policy started. Also, the policies may include a dollar limit on your healthcare benefits. Pay close attention to that if this ends up being something that you're shopping for. The ACA policies cannot have a dollar limit. If you purchase a short-term disability policy, that has $1 million limit, you're probably okay. But if you're looking at a policy and it says, oh, it's got a $20,000 limit, a $40,000 limit, be careful. One trip to the emergency room could cost you that much money. There are other policies that are available, limited benefit health insurance policies. There are several types of these limited benefit health insurance policies that are available from companies in Maryland. They are not major medical health insurance. They all include limited benefits, and the plans are not obligated to cover the health benefits required for major medical plans under federal law, which means they're not required to follow the ACA. These plans are called accepted benefit plans. Accepted benefit plans are not equal to major medical plans, but they can pay some portion of individuals' healthcare costs in situations where, and it's really important here, because if you're going to seriously consider a limited benefit plan, you got to make sure anyone can purchase one, but it's important to look elsewhere, except for the situations where you don't have access to health insurance through employment. So you're not being offered health insurance through your employment, and you don't have access to health insurance through a parent or a spouse. You don't qualify for Medicare, Medicaid, or another healthcare program, and you don't have the financial resources to purchase major medical health insurance from the Health Connection or directly from the insurers. So we're saying only if all of these situations are true for you, should you look at the limited benefit insurance plans as an option. Because health insurance through your employment is going to be a better option. Access to health insurance through a parent or a spouse is going to be a better option. Medicare, Medicaid, and other government programs are better options. And if you do have the financial resources to purchase a major medical health insurance plan from the Health Connection or off the exchange, those are better options than these limited benefit plans. However, if all of those things are true and you don't have access to any of that, then you might want to look at the limited benefit plans. So at least you have some coverage. So it's important that Marylanders interested in these plans clearly understand what they're purchasing, clearly understand what purchasing. Make sure that you are working with someone who can explain it. You can contact the Maryland Insurance Administration if you have questions. But if you are working with somebody and you are confused, if they're explaining an insurance product to you and you still can't understand it, you might not be working with the best agent or broker for you, because an agent or a broker and someone selling a product should be able to explain it in a way that you understand it. And you should not be purchasing an insurance product that you do not understand. So it's important that you clearly understand what you're purchasing and that you understand that these plans have fewer benefits and fewer consumer protections under the law. Again, don't hesitate to call us. It's 1-800-492-6116. That is the Maryland Insurance Administration's phone line. And if you want to call and discuss this. And I think on my next page, I go into a little bit more detail about the different kinds of limited benefits. Okay, I do not. I think I'm gonna stop sharing this PowerPoint, and I am going to bring up a website for everybody real quick, just so I can spend a few minutes showing you that. So just give me about 1 minute to do that here.
while Patricia's pulling that up, I do want to mention just really quickly that a lot of the resources that we're going to be sharing today, I will be sending to you via email later this week, and the recording, you'll have access to it via YouTube. So I just wanted to mention that.
So, all right. This is the Maryland Insurance Administration's page on health insurance and healthcare resources for those uninsured or lacking legal status. I'm going to put this link in the chat. And this is where you can get more information on all of what I've covered so far. So, this link here that says click here to learn how to purchase health insurance if you're an immigrant without legal immigration status. And it's in Spanish and Korean as well. That's going to walk you through what I walked you through earlier with regards to the current rules for purchasing plans on the Maryland Health Connection, as well all of that additional information regarding purchasing it off exchange. And so that's what that document is there. The next part goes into that short-term limited duration coverage, which we already covered a bit. Again, it's in English, it's in Spanish, it's in Korean. And then the limited benefit health insurance coverage information as well. And I'm just going to spend a couple minutes on this. I will go, down the rabbit hole a little bit more if someone has any questions about any of these specific products, but just know that you can find that information on this site. So you can go to the MIA site, find that information. Accident-only accidental death and dismemberment policies. You might be familiar with those because you've been offered them through your bank. It's really common. You can go purchase them, from lots of different agents, brokers, insurance companies. But a lot of people get them because they are offered. It's offered to them for just a few dollars a month through their bank. All that gives you is coverage. In a sense, it's like a life insurance product. So if you're killed in an accident, your beneficiaries will receive a certain amount of money. But also the dismemberment part means that you will receive a certain amount of money if you lose your vision, or in most cases, the way it's written is vision or a limb. You get X amount of money, usually as a lump sum. So it does give you a certain amount of really, really catastrophic coverage, but just understand what you're paying for. With hospital indemnity and fixed indemnity plans, they're going to give you a fixed amount of money for certain situations. So maybe they're going to pay for 4 doctor's visits a year at $150 each. I mean, they can be designed in whatever way, essentially almost, that they want to design it in. They can say, you get $150. We're going to pay $150 toward an MRI, which would not even come remotely close to touching the cost of an MRI. Or it could say that they'll pay $1,000 toward an MRI, but they're fixed amounts, and they might not correlate very well with the actual amount of the service. So an indemnity policy will give you some coverage for certain services that you receive or certain days in the hospital. You're going to get a fixed amount of money for that, but that's not the same as health insurance, or it's not the same as major medical health insurance. It's a kind of health insurance that just helps you out with some of the costs. They can be relatively inexpensive, and they do provide some coverage, and they can be an option in certain situations. Specified disease / critical illness plans. I think some people have a certain amount of familiarity with these plans. They can be plans that give you coverage for a specific disease, or a specific category of diseases like cancer. So a cancer policy is relatively common. In that situation, there's several different ways that the policies can be designed. They might pay you $150 a day for every day that you receive treatment. But it's essentially reimbursing you for some costs. They're not going to be paying providers directly. They're not going to be paying hospitals directly. They're going to be giving you a certain amount of money for, a lot of times it's each day of treatment with a cancer policy, or it could be a lump sum. If you receive this diagnosis, then you receive $30,000 to essentially cover your care. So just if you're interested in those policies, pay close attention to what you're purchasing, reach out, ask questions, and definitely educate yourself. So I am going to stop sharing right now. I'm going to ask if anyone has any questions. I think there's a question in the chat. Just to confirm that it starts in 2026, but in fall of 2025, they can begin purchasing their plan. I do believe that is the case. So during the 2025 open enrollment. Jessica asks, when working with an agent broker, how can one verify that they are licensed in Maryland? You can go through our website and verify that information yourself, or you can just call us and have us verify that information for you. And then Angela says, families who are coming to the country with a family reunification parole are eligible to apply for the health insurance program. I'm not exactly sure. I'm not exactly sure what you're asking, Angela, and I don't think I could answer that question off the cuff anyway. So if you want to shoot me an email, I'm going to put my email in the chat and we can try to get that question answered for you. Have any other questions for me?
Okay, well, I don't know if anybody has any last questions or anything regarding that. But otherwise, I don't know, Patricia, if there was anything else you wanted to add, um, left over.
I mean, I think I'm happy to answer questions. I think, like I had said earlier, the MIA can certainly help you with your health insurance related questions, certainly help you if you are looking for health insurance, if you are undocumented, or have a legal status. You can certainly reach out to us if we are not the right entity for you to get to. We are certainly going to help you get to the right entity through our HCAT team. You can, Jan, would you mind really quick putting the email for HCAT in the chat? You can shoot us an email, and we will get your questions answered. But I think that's all I have if no one else has any questions.
No worries, but her information is in the chat. Oh, I think we do have one question or comment. Lisa?
Greetings all. Thank you. I had put it in the chat. For the
Okay.
short term, how soon can they use the benefits? Is there a certain time they can use it, or is it right away?
If you purchased a short-term limited benefit plan, it's possible that it could go into effect the same day, the next day, etc. So those plans don't have to necessarily, with the ACA plans, they're usually starting the first of the next month or on the first. With those short-term plans, it could be something that goes into effect as soon as you purchase the plan, as soon as you're approved and you purchase the plan itself.
Okay,
Does
because
that
I
answer your question?
yes, because a lot of times when you get sometimes those short term, it may not go into effect like the next calendar day of purchase that you have received.
Yeah, I mean, it could be the next calendar day.
Like, well, as far as if you purchase it the 5th, it will be the next month calendar day, the 5th.
I mean, it's possible that they would design it like that, but the whole purpose of these short-term plans is to bridge a small gap in insurance. And so most of them should go into effect almost immediately.
Okay. Okay. Because I know a
They're
lot of,
only designed, sorry, what?
I'm sorry. Go ahead.
No, they're only designed to last 90 days. So if you had to wait 20 days to get your 90-day policy, that's not very useful.
Right. Because it would go on to the next one, how they plan it out, and that's why you have to be careful with the scams that they have going on.
Yeah.
Because a lot of families just want it for the immunizations because they're ridiculous for like one shot. I know one family paid close to 150 for one shot and they had to get 5 shots.
Yeah.
And they just wanted for that because it was going to be a value to them.
I would say to everybody that's here, if you end up needing one of these short-term policies, or if you end up working with somebody or knowing somebody who does, reach out. Thanks, Jan, for putting Jan put the HCAT information, the phone number in there. Reach out to us at the HCAT program because we can save you a lot of time. There are only 2 companies currently offering the short-term products in the state of Maryland. And one of those companies requires you to also purchase an indemnity policy with your short-term policy. So I think that is a much less desirable situation. So if you end up knowing somebody who is interested in or needs to get one of those bridges, reach out to us because we can kind of fast track you the companies that you can call so you don't have to waste a lot of your time shopping around and finding out that somebody's not selling the product. And that changes. I mean, that can change. We check it every year to make sure that we know who's selling the short-term limited duration products. But again, that can change from year to year. So just reach out to us if you have questions about that.
Okay, well, thank you so much, for all of that great information and for all the contact and links that you were able to provide for us. I think it's very helpful to start thinking about this and learning a little bit more, especially with, this new legislation that is going to be right around the corner. And we're going to see a lot of individuals who are going to need a lot of this information. So thank you so much for that. And so now we're going to transition a little bit towards what are the healthcare resources for the uninsured population that's available right now? Considering that this legislation, we won't be able to have, these individuals purchase the insurance until next fall. It won't be active until the following year, which is 2026. And so I wanted to share a little bit about the primary care services, just highlight a little bit about, what is the need for it? How do you access it? It varies, based on what county you're in. There's a lot of centers that are either privately funded or are federally funded that one can access. And so, one thing I do want to highlight is that health screenings, are looking for diseases or conditions before, you have symptoms to identify chronic conditions early while they're still treatable. So many chronic medical conditions have little or no symptoms in the early stages, but can still cause damage that may worsen over time. So, staying protective with yearly health screenings and checkups with our doctor can definitely allow us to prevent a lot of the diseases from continuing to develop. So, of course, we know that there's not, enough screenings for every single thing out there, but for a wide range of chronic diseases, we can start screening now. Maybe in the future, there'll be additional tests that we can do so that way, we can prevent other diseases. And one thing I do know is that for those who do like genetic testing, for example, if there is like a new type of screening or a new marker in your genetics that puts you at risk for a certain type of disease, as science continues to unfold, they do contact you to let you know that you may be at risk for a certain thing. So, seeking primary care is super important. So primary care, for those who are maybe not too familiar, this is going to be our medical provider who's at the center of our health care professional. So this is the person that we go to, whether it's because we have a cold or we need to go in for, our annual physical wellness appointment. And so this individual, this provider, may be a nurse practitioner, it may be an MD, or it may be a physician's assistant who works with an MD, to be able to provide that primary care services. So it's crucial to first go to a primary care doctor, maybe, when we have a baby, right? That's definitely somebody, the pediatrician who's providing that primary care pediatric services to the baby. And then as you become, older, 18 years old plus, that's when you start maybe seeing maybe family doctor. Well, family doctor you may see at all point of time, but you may see a doctor who just sees adults. But one thing to take into account is that, it's crucial for us to stay on top of like what vaccines we're getting, what screenings we're getting. And so before we dive into, how do you actually access these resources, I did want to share, this chart here, which I will be sending it to everybody, where it starts to explain, what vaccines are recommended for what age. And as you see here, that newborns and infants, that newborns should receive a comprehensive health screening to access hearing, vision, blood pressure, and assess heart rate. So in addition to physical measurements and screenings, other blood tests may be done to screen for rare diseases or disorders in just first few days of life. And so infants should visit their healthcare provider at 2 months, 4 months, 6 months, 9 months, or as needed if you feel that maybe there's an infant that may be sick, or you're not sure if they're developing as planned. Early childhood, so when we're talking about early childhood, that's going to be young children, that at 12 months to 15 months, 18 months, and 24 months, and even 30 months, where we want them to start having those annual screenings, which should be sufficient unless, your child has specific medical concerns. So specific health conditions such as anemia, maybe asthma, may need to be assessed a little bit more frequently, or maybe visit the primary care doctor for medication and just follow up to see how everything is going. And then this also applies to, young children, generally up to the age of 10. So annual health screenings are recommended to maintain general health and screen for common health conditions. These yearly routine wellness visits assess the child's growth and development and measure things like vision, hearing, and heart rate. And so especially around this age of 10, we start getting to the conversation about puberty. And so because we do have, and we're starting to see a lot of youth, especially young girls at around the age of 8, 9, they're starting to have puberty at a younger age, which is those ages than, a couple years ago, where it was mostly like in middle school where you expected them to start presenting, puberty, signs of puberty. So this is something really important to start, bringing your children to the doctor, pediatrician, to be able to assess for those things. So, the same screenings apply to, again, like those middle childhood age range. So however, in this stage, health screenings are especially important, again, to monitor specific needs of the age range, such as vaccinations, sexually transmitted infections, changes in weight, etc. As children's body begin to change, it is important to stay on top of yearly preventative health screenings and to help build a habit they're going to continue throughout adulthood. At least that's the hope. And then when we're talking about ages 18 and up, that's when we start looking at these other screenings. Maybe we start doing a little bit more. We start maybe doing some tests for cancer screenings. And this is a beautiful chart that lays it out, where basically, based if you have, like, for example, if you identify as a woman or have a cervix, they do recommend in your early 20s to start doing a pelvic exam and a pap smear, as you see here, starting at the age of 21, unless there's reason to do it a little bit younger. Then they do recommend for you to do that to test for cancer. Especially starting this time, they may test it, during childhood and adolescence, your blood glucose and cholesterol, but they'll especially focus on that during your early adulthood. And so with blood glucose and cholesterol screening, it's recommended to at least do it every 5 years, but it's possible to do that, in your annual visits. And you may have to do it a little bit more frequently based on maybe your health conditions at that time. So if you have diabetes, or if you're pre-diabetic, if you're pregnant, or if you are having symptoms of maybe chest pain, etc., there might be some additional testing regarding blood, glucose, and cholesterol. There'll also be exams, during this time period for thyroid stimulation, possibly again, if needed, they'll do this also maybe during adolescence or at a younger age. So that way they can make sure that it's working as it's supposed to. And this is usually for individuals who are maybe having some symptoms of an overactive or an underactive thyroid. 40s, that's when we definitely want to start talking about mammograms. We want to talk about ovarian screenings, definitely continue the conversation about cervical cancer screenings, and also colonoscopy, which tends to, if there is no symptoms, meaning everything is well, then it's probably maybe done every 10 years based on whatever exam that you're doing, whatever screening, because there's different ways to screen different types of cancers and other conditions. But with colonoscopy, we'll talk a little bit about that in just a moment, what some of those screenings are. 50s and 60s, bone density test. So it's super important to stay on top of our nutrition. So that way, we can definitely make sure that we're not having low bone density. This is something typically that we're going to start seeing maybe testing, unless again, if there's a need to test it a little bit earlier, it's going to be starting at the age of 65 for testing of osteoporosis. And that's going to be maybe every 3 years. Coronary screening, that may be a yearly test for your heart disease. Also, maybe low dose of a CT scan starting at the age of 50. At all ages, we definitely want to make sure that we're screening our skin, making sure if there's any rashes or anything like that, maybe signs of skin cancer. We do want to see a dermatologist maybe annually. If not, you can address some of those concerns with your pediatrician or your primary care doctor, who will let you know that maybe you should talk to a dermatologist. Eye exam, we do want to start doing that at all ages, right? To make sure that our vision is well, that we're able to see. Also, we all want to make sure that there is no diseases being, or signs of diseases in our eyes. Because, for example, those who have diabetes, their vision is often affected, or if they have other eye conditions, the ophthalmologist will be able to make sure that everything's going well. Hearing tests, likewise, I remember definitely when I was in elementary school doing a hearing test. And so that might be something that your children may experience now, but definitely will continue to be a focus as you get older in your screening. So for men or individuals who have testicles, they will be, recommended, especially in their early 20s, for testicular cancer. I do want to let you know that with testicular cancer can happen very early on. So for example, we have heard there be problems with the testicles, from infant or young childhood or adolescence. But with testicular cancer, we definitely see it within that adolescence to early 20s age range. And so this is something that the pediatrician or primary care doctor will be able to, educate the individual on how to maybe screen for themselves at home and how can they check on that, during their primary care visits. Again, also blood glucose, cholesterol screenings. Again, 40, we want to definitely highlight for for all genders, that colonoscopy screenings is crucial at this time. And maybe at this time we start introducing the conversation about thyroid checks. And then in the 50s and 60s, we start really talking about prostate screening and for prostate cancer. And so that might be every 2 years, beginning at the age of 50. There's different ways to test for that, whether that is through blood sample, screening of your blood, also tactile test. And so there's a couple of different ways to do that. Also the bone density coronary screening. And as you see there, as mentioned for women, that at all age ranges, we're going to talk about skin screening, eye exam, and hearing tests. So the reason to talk about that was just because a lot of the times, we talk about, yes, we need to go see a primary care doctor, but like for what? And so this is something that I'll be able to share with all of you. So that way you can also make sure, kind of like a checklist to see, what should I start talking about with my primary care doctor as I make an appointment? So now talking about the actual resource of primary care doctors. So there is the federally qualified health centers, which basically is centers that are federally funded to be able to provide low-cost healthcare services to the community who do not have access to insurance or are not eligible. So we have those centers as well as privately funded centers. So privately funded meaning that they do not receive they do not receive funding from the federal government, but they are privately funded, maybe through local community or a group of like providers, or sometimes there is some providers. I know some clinics that actually the doctors just volunteer their time to be able to provide services. And so when we're talking about the primary care clinic, so they're going to ask for a series of documents. They're going to ask for possibly, especially the federally qualified health center, sorry, it's a long name, is going to be, proof of address, proof of income. It might be an ID. It might be some additional documentation. Like, for example, if you have your medical records, whether that is from another country or from another clinic, you may want to bring that along with your medication or a list of medications that you've taken. And so these clinics that you see here and this is going to be something that I'm sharing with everybody, is going to be the list here. This is mostly within Central Maryland and Washington, D.C., but we are actually working in our team, hopefully by the end of the week, to be able to provide you for the health centers for all of Maryland that are both privately and federally qualified. But there is a way that you can actually find that information if you are antsy to find out, where can I go that is going to be low cost and it's going to have a sliding scale. And for those who are not familiar with sliding scale, basically based on your income, they will be able to give you a reduced cost based on your income for the services that you'll be getting. So I'm going to put this link in the chat here, but basically this is a link from HRSA where you can just type in your zip code. So I'm going to put in, for example, I think I already had searched it, but let's say, oops, not that one, 2, 3. So Gaithersburg, Maryland. So I can select that and it's going to show me a list of the federally qualified health centers here that I could start to maybe call to see if I'm, I can be a patient. I do want to advise everybody that, or let everybody know that when you're calling these health centers, one, it may take a little bit of time for them to answer your phone call. So do, take that into account, that when you call, it's not going to be straight away that they may answer your call. You may be put on hold. So what I always say is, as you're going to go do a walk or you're in between washing the dishes or something during the day or at work during your lunch, just go ahead and call. You'll be on the wait call. You'll be put on wait and hold. And then once they answer you, you'll be able to schedule your appointment. They'll also let you know what other documents to bring. So all of these health centers that you see here in the clinics, they all provide different services. More than anything, they're all providing primary care. So they'll have that primary doctor who will be able to direct you to maybe specialists if you need that. So it is recommended that before, you seek a specialist to visit a primary care doctor first. These appointments are also something that we're seeing with the federally qualified health centers is that they are at capacity. So do not be surprised if some of the centers, when you call them, they say, we're at capacity, we don't have any more appointments, or we're not accepting any more patients. Don't feel discouraged. It might be you have to call another clinic. So that way you can get an appointment. So that's why we tried to put that list together so you have many options of places that you can call. Something that I've also seen, the average time to get an appointment is, I think within 3 to 6 months from your initial call. So for example, if I were to call today, it's possible that I don't get an appointment until maybe September, or a little bit after. So right now, if you are not sick, I highly recommend for you to schedule an appointment with a primary care doctor because you don't know what can happen within those couple months. It is better to do that instead of, calling with an emergency. And so with our health centers, that is something I do want to share with all of you. There is another privately funded health center, which is called the American Diversity Group. And that is a group that's a clinic. Let me see if I can pull it up. Diversity Group. That is a clinic that is basically free of charge. It's open on the weekends with no appointment, no questions asked about documentation or income or things like that. They might ask your name, just so and phone number and things like that, so that way they can track you as a patient. But basically, it is open to anybody who can go. So meaning it is not specific to a county in Maryland. But they are in Silver Spring, if you're familiar with the Adventist White Oak Medical Center in White Oak. It's right around the corner from there, and you can go on the weekends between 10 to 2. I think right now they have it every Sunday. Sometimes I've seen it every Saturday and Sunday, like here, for specific types of services that they have. And they provide primary care visits. They do some assistance with medications and some other things. They're a really great group to follow on social media. So if you are on Facebook, please feel free to follow them. And they are great people. I've worked with them before. So just know that because it is a walk-in and it's open to everybody who can come, there might be a waiting period. And so I do recommend you going a little bit early. And so I want to pause there if there's any specific questions to any of those things related to primary care. Any questions? And I think, as I mentioned, each center is going to have different resources. So, for example, I can tell you that with Planned Parenthood, they have reproductive health services and primary care, but they do not have prenatal care. Some other clinics like CCI, LA and Ellis, Greater Baden will have those what I just mentioned, but also have prenatal care. And some clinics may have dental. Some may have behavioral health services. So based on what you're looking for, we try to make different lists on our end at Coaching Salud Holística, so that way it's a little bit easier to at least identify. If not, you're more than welcome to check out their websites. They have all of their information on there. They also do have, you can also call if you want to find more information about like what documents you would need to bring, what are the costs associated based on your income, etc. So those are some things there. And yeah, is there any questions regarding the primary care? No?
Hi there, Jocelyn. It's Lindsay.
Hi.
Hey there. So I was wondering, do you provide like a list of things that patients should, be asking their primary care doctor for? I went to the doctor the other day and I felt like, I didn't have all of my questions in order, and she didn't ask me about some things that I was wondering about. Oh, did you just drop something in the chat?
It was the list of the clinics. Yes.
Oh, great, thanks. Yeah, so just wondering how I can support people in advocating for their health once they're in with the doctor.
Yeah, so we do have, like for example, especially like in our cancer slides that we're going to show in just a moment, we even put there like what are questions to ask. And so we do have a checklist that we are making right now. We're actually, our goal is to finish it today, so that way we can send it to you tomorrow. Basically a checklist kind of like this, where you see like based on age, what should I be asking about? And then, how do I ask for an interpreter? What are your rights and so forth. And so we are putting that nicely together so that way we can send it to everybody in English and Spanish. So hopefully that's something that will be helpful for that.
That's amazing. Thank you so much. And I could see myself passing it along to also like the nurse at school, so thanks.
Of course. Any other questions or anything about primary care? Okay, so primary care tends to be a little bit more straightforward. So now talking about prenatal care. So many of you may be familiar, maybe you're not familiar just yet. but we do have some legislation that basically became active last year. So starting July 1st of 2023, regardless of immigration status, if you meet the income requirements, and you live in Maryland, and you're pregnant, you do get prenatal care during pregnancy and also 4 months of postpartum care. So you, as somebody who is able to apply under the Healthy Babies Equity Act, you go through the Maryland Health Connections website, you can call, and basically you get the same benefits as somebody who traditionally already has Medicaid. So what that means is that somebody under the Healthy Babies Equity Act, if they're pregnant again and they're regardless of immigration status, they're going to get insurance during their pregnancy, 4 months postpartum, and they can see a primary care doctor, they can get dental services, they can see behavioral health services and professionals, they can get transportation assistance, for example, like Metro Access. They will be able to get that. Especially for like our pregnant moms, they will be able to, they just got to get a letter filled out and they can apply for Metro Access or other transportation related services that are covered by the insurance. They're able to get a wide range of other things, assistance with prescription, and a whole bunch of stuff that is very important to just let pregnant individuals know that there is now this act. For many years we've had based on each county, some people were able to get low cost prenatal care, some people had to pay the full price. But now with the Healthy Babies Equity Act, as long as you live in Maryland, meet the income requirements, and are able to submit all the documents that are necessary, you will be able to get Medicaid. From there, they would assist you in with the when you're calling or applying for it, finding providers. And if you by chance are not able to find a provider, there is a couple ways that you can find that information. But something that we do want to encourage everybody is that once you do get insurance, is to either call your insurance carrier or to go on the website of that insurance carrier, and you can actually put there find a doctor, you click their OBGYN or whatever provider you're looking for, and you might type in there what type of what's your group plan that's in your insurance card, and then it will come up with a list there, and you can even select if you want it in Spanish or English. This is something I do want to say that it is only in Maryland, and so it does not apply for Washington, D.C. And also there is no public charge. So what that means is that for the individuals who are undocumented, they are not going to have, let's say, like a consequence to having applied for this. If one day they're looking to apply for their green card or somebody else in their family is looking to apply for it, they do not have to pay this back in the future. And so this is something we do want to share with everybody who is pregnant, or if we're working with the pregnant population, let's get this information out there so that way they can best utilize the services, because with that insurance, they can get a whole bunch of other things. We actually have 2 videos, one in English, one in Spanish, on our YouTube page, where you can actually watch video that we created on all the insurance, all the providers that you can get under an insurance. You can see a physical therapist. You can get a doula, which is somebody who would be an advocate to help you, an advocate or somebody to help you during your childbirth. You can also get a lactation consultant. You can get that breast pump covered by the insurance during this time. So, and I know with like certain MCOs, like the Medicaids, based on which one you purchase or select, you can get certain benefits. So for example, I know with Priority Partners, I know that there's some food markets where basically if you show your insurance card, they're able to give you a discount at the food market. And then I know with like Aetna, for example, that if for those who have Aetna and they're pregnant, they do assist them with diapers. And so there's different benefits based on which insurance is you choose. I do say as you're selecting this, what insurance, whether that's Priority Partners, Aetna, WellPoint, etc., that you look at what is the type of insurance that the providers around you accept. So for example, not everybody, let's say there might be in one county providers who accept more of one type of insurance than another type of insurance. So if you are someone, let's say, who gets, let's say I'm in one county and all the providers, accept, or they don't really accept, let's say, priority partners, but they accept all these other insurances. And if I have priority partners, it is really hard for me to find a provider. So you have like about 30 days to make a change to your insurance selection, if anything. And so, yes, the MCOs are the managed care organizations. And so if you're looking for that additional information about, what type of doctors you can see during your pregnancy, we will share those resources as well as the videos that you can watch to learn more about that. And I do want to say, with doulas, I'm very biased. I love doulas, and so I think everybody should have a doula, and that's going to be that person who's there for you again during your birth, while everybody's there kind of focused on the baby. And so it's a great support for our pregnant person. Any questions about the Healthy Babies Equity Act before I continue to the other resources? Okay. So there is also the National Maternal Mental Health Hotline. So basically, does not matter immigration status or anything. Anybody can call. It's available in English and Spanish, available 24/7. Where if we have somebody, and they do accept also, dads for calling. It's not just always moms, but mom is the focus because it tends to be the person who gets most affected at birth and during pregnancy. If she is having or they are having maybe severe depression or feel like they're having a crisis, mental health crisis, they can call this number and they can also text it. And so this is free, it's confidential. And if anything, they would be able to provide support over the phone. And if needed, they may call, let's say, first responders to come out to the scene so that way they can make sure that everybody is safe. And so this is a great resource that I highly recommend to everybody. And so does not matter, again, immigration status. We also know of the Postpartum Support International, which is maternal mental health services as well, that they do have a similar concept where they have a support line that is international, not just in the US, whereas the other one was just in the US. There's an international line and there's the national line here in the US, which is the second number that you see there on the left. And then they also, the Postpartum Support International, have a large amount of support groups online. So support groups are going to be, where people who have similar experiences or are going through the same thing are able to meet for free online with a professional in the group to be able to get that support, whether it's because a couple lost a baby during pregnancy or postpartum, or if somebody's having postpartum depression, or it's just the simpleness of like anxiety of, raising a baby, or support groups just for dads. So there's a wide range of different types of groups. Last time I counted, I think there was like over 15 types of groups in English and in Spanish to help those who are raising infants or are currently pregnant. I love it because it's free, and also it doesn't matter, if you live in another country, you can still join. Just the time zones, they do show it there. If it's like East Coast or whatever it is, they do have that information on there. So they do post a lot online on their social media, but you can also visit their website. And again, all of this will be shared in an email, nicely wrapped up for you. Any questions regarding the prenatal care or maternal mental health services before we talk about the cancer screenings? Okay. And if you are actually a professional working in the maternal mental health space, you can actually participate in the Postpartum Support International. These are experts and specialists who volunteer their time to run these groups. So we do want to encourage that. And if you're somebody who speaks a different language from English and Spanish, I definitely encourage you to reach out to them, because there's a way that you can sign up to be a provider for the support groups. So now talking about cancer screening. So here's when we start talking about, logistics of like what is needed for documentation and like what county and so forth. So one thing I do want everybody to know, we're going to talk mostly about breast cancer. We're going to talk about cervical cancer, and also colorectal cancer, because those are the ones that are most available for screenings. For all other types of screenings, we're going to refer you to go to your primary care doctor, who would be able to connect you with another specialist. Based on some counties, they have other screenings that are low cost or free. So for example, I know in Cecil County, they have skin cancer, lung cancer screenings, and then some other counties they have that, and then other counties don't even have any of that. And so these are the top 3 screenings that across the state of Maryland that we have in each county. And so with breast cancer is a disease in which cells in the breast grow out of control. So there's different types of breast cancer, and the kind of breast cancer depends on what cells in the breast turn into cancer. So some things that put us to risk are going to be that we're 40 years old or older, our family or personal history, meaning if mom, sister, maybe grandma, aunt had breast cancer, that may put us at a higher risk for breast cancer. If we have a history of breast cancer ourselves, that may be something that puts us at risk. Dense breast, which is you can only find that out through your first mammogram. Well, they'll let you know that you have dense breasts. Obese. So, making sure that we're having a balanced diet and we're exercising, we're managing stress, because stress is also a contributing factor to cancer. Smoking and drinking can also put us at risk for breast cancer. And there's a couple other things that can put us at risk. We do have a couple sessions lined up for this fall regarding breast cancer in English and Spanish. We're going to have sessions where you can come talk to us, and we'll dive a little bit deeper into what breast cancer is. So if you have insurance and you need to see, get breast cancer screening and get mammograms, etc., or get treatment for it, then you can call your insurance, so that way you're connected to your primary care doctor, who may connect you to an oncologist, and then from there they'll be able to connect you to the services that you need. You are more than encouraged to contact your insurance carrier to ask them, how much is this going to cost? How much is this if I go with this clinic, or if I go to this other clinic? So you can find that information out, but remember that you have resources like the Maryland Insurance Administration to kind of help you navigate a little bit with that also. There's quite a bit of questions that you can ask your doctor. For example, do I have a higher than average risk for breast cancer? How often should I get a mammogram? What should I do to prepare, etc. So some of those resources that are going to be included for breast cancer screening, these are the numbers that you can call based on what county. And don't worry if you can't jot it all down, you'll be able to get this also sent to you. I do want to mention that in some of the places, in some counties, they do have 2 different phone lines, one that's in English and one that's in Spanish, that you could call it, for example, in Frederick. And then some other ones that they might not have that differentiation. Maybe when you call, there might be an operator where it says if you want it in Spanish, click whatever number. But if it does not show that, options on the menu. And I say Spanish, I do want to just disclaim that I work a lot with the Spanish speaking population. So if you hear me use that example, that is why. But let's say something that I encourage as a community health worker to the community is that if you don't speak English, when you call, at least learn how to say the language you speak in English. So for example, if I'm a Spanish speaker and I'm calling, and there's no way for me to get a Spanish speaker on the phone to answer, what I'm going to do is what I'm encouraging the community to learn is to say Spanish, please, or Spanish interpreter, or just Spanish. And hopefully the goal is that the person who answers can get an interpreter for that individual. Sometimes we've had it where, I can tell you myself, where people have called and they're speaking in a different language, and I have no idea what language they're speaking because I don't speak that language. But if they were to say that, the language that they speak in, like in the English translation, then I would know what type of interpreter to get. And so that's something definitely I encourage everybody to just spread that awareness. This is a friendly reminder again that at 40 years old, definitely start having the conversation unless you have symptoms of maybe lumps or discharge of the nipple or any other type of like red markings and things like that. Anything that's unusual to you, to call your primary care doctor or to schedule an appointment, especially if you are ready for breast cancer screening. Now we have sometimes a question of, what if I'm not 40 years old and I'm having symptoms? You know, what do I do? So usually what I do when I'm working with an individual is, I have them see a primary care doctor first, so that way they can get a letter of necessity. That letter of necessity is basically a doctor saying that this individual is having symptoms, maybe X, Y, and Z. If anything, they may not even say that, but that basically they need a mammogram or they need whatever service that they're looking for. And so with that letter, what that person who's maybe 30 years old, I will tell them, keep that letter. Now let's call. We're going to call. And if they say like, oh, but you're not 40, you're not eligible yet to take the screening. And then what I would say is, as the patient, well, I have the letter from my doctor of the letter of the necessity, that I do need this. And so I need the mammogram. So with that letter of necessity, it allows them to then be able to schedule you for an appointment for a mammogram. But it's so important to have that letter of necessity if you are under the age of 40 and are presenting symptoms of breast cancer or any type of cancer. And then I forgot what else I was going to say, but if there's any question, is there any questions regarding breast cancer screenings?
Something I heard recently is that it's your right to ask if the person that is going to be reading your mammogram results is someone who spends the majority of their job looking at mammogram results, just because it is a complex type of, niche area. And I know that's not always available, but just something to ask,
Oh,
I
yeah.
guess they can tell you what they want, but it's a little
Yeah.
something. Yeah.
No, yeah, thank you so much. Yes, and I actually think that's one of the questions on our
Mm.
pamphlet where it says like, who's gonna read me the results and like ask
Mm.
about that. Yeah, so
Thank
thank you so much for bringing that up.
you.
And so also for these type of screenings, so these are typically with the Department of Health, except for some of the counties like Montgomery County, where it is no longer with the Department of Health, the breast cancer screening. These Montgomery County, it does require you to go to specific health clinics to schedule an appointment with a primary care doctor, and then you can schedule that. That has its own, may have its own barriers in a way. But that's why we want to make sure we are all about prevention and early detection, right? As soon as, we come across somebody who has never been with a primary care doctor, we want to connect them so that way you guys can go to that and get that help. For all of these screenings that I'm going to be talking about and almost all the services that we've been talking about so far, they're going to ask you for the same documents, which is going to be proof of income, proof of address, maybe ID, it could be a passport. It might be the proof of address is just to ensure that you live in that county and also in the state of Maryland. And then also the income is just to make sure that you are somebody who may be in need. I believe for most of the counties, they're looking at for people who are low income. And so that means, under the federal poverty line. And so what's another great thing about this is for people who do not have a legal immigration status, they can go to these Department of Health or these services to get breast cancer screening. And it's not, again, going to affect immigration status at any point in time. And then if somebody is diagnosed with breast cancer, then they would get them that assistance within that clinic or that center, so that way they can apply for state assistance for maybe treatment and surgery, or anything else that they may need. So I think breast cancer actually has like the most resources. So that is something that, definitely seek out if you are interested in accessing that. And at the very end today, by the way, I'm going to share our links so that way if you have any questions, you can contact us. If there's a community member who has a question, doesn't really understand any of, this, they can fill out their information and one of our community health workers on our team can give them a call back just so that way they can answer those questions of like, here's where you go for this, or, this might be the documents that you may need and so forth. Then we have cervical screening, cervical cancer, which is this, similar, where cancer is a disease caused by uncontrolled division of abnormal cells in part of the body. When cancer starts in the cervix, it is called cervical cancer. So this is for our individuals who have cervix, regardless of gender. Some things that put you at risk are going to be unsafe sex, such that causes you to be exposed to HPV or HIV. Family history, HIV and AIDS can also put you at risk for cervical cancer. Long-term use of oral contraceptives, so meaning using birth control pills for over 5 years, has shown to put somebody at risk for cervical cancer. And it also, I think what wasn't included in the other slide for breast cancer is that oral contraceptives can also put somebody at risk for breast cancer, especially if they have a family history. So definitely talking to a gynecologist about your options of contraceptives is important, especially for you if you have any of these like family history or have HIV. Smoking typically puts us at risk for all types of cancer. And again, if you have insurance, speak with your insurance provider or primary care doctor to be able to discuss cervical cancer screenings. With cervical cancer, we know that we have our, it's called the Pap test or the Pap smear, which is a procedure that collects cells from the cervix so they can examine closely in the laboratory to detect cancer or precancer. And so they'll use this instrument, as you see here, and they'll enter it in through the vagina to brush the cervix so that way they can assess those cells. And so this is what a Pap smear or Pap test is. It is very different from a pelvic exam. I do want to highlight that those are very two different things. If this device is not used, then that is not a Pap smear or a Pap test. But the cervical cancer screenings typically go hand in hand with the breast cancer screenings, and so they'll typically be in the same place, and they are going to require, again, those same documents. And so I'm pausing this here, so if you want to take a picture of it or you want to write it down, but I do want to share in the meantime some tips when scheduling your Pap smear, is to try not to schedule your appointment for a time during your menstrual period. The best time is at least 5 days after your period stops. Do not use tampons, birth control foams, or jellies, other vaginal creams or moisturizers or lubricants, or even vaginal medications for 2 to 3 days before your Pap test. And do not shower, that same day, so that way they can really collect, all of those appropriate cells and do the proper test. They may even tell you, some doctors even say don't shower 2 days before the Pap test. You can talk to your provider when you're scheduling the appointment, what do they recommend? And also that includes, what are their recommendations for vaginal sex for your Pap test. So that is some information that I want to share with everybody regarding the cervical cancer screening. Any questions about cervical cancer screenings? It's kind of straightforward also, but okay. So colorectal cancer. Oh, yes. I see in the chat, are the resources connected to Coaching Statistica or independent facilities? When people call, how should they ask for a free screening? So when they're contacting us and we contact them back, we're not affiliated with these health centers. We're merely a source of information for the community, so that way they best understand how to navigate these resources. So for example, if they call us, they will not be scheduling an appointment with us. If anything, they could contact us if saying like, I live in such and such county, I don't know where to go for health screenings regarding cervical or HIV. And then that's when we'll be able to tell them like, hey, this is where you go based on like the list. These are the places that are free and low cost. And if they're eligible for insurance, then we always give them that information through Maryland Health Connections. So hopefully I was able to answer your question. But yes, so with colorectal cancer, same concept where it's an abnormal growth in the colon and rectal area, so rectum, and typically what puts you at risk, and we start talking about screenings for colorectal cancer, is going to be at starting 45 years old, unless there's, reason to do the screenings a little bit younger. Family history, inflammatory bowel syndrome, low fiber and high fat diets can put us at risk for colorectal cancer, and again, smoking. Again, I reiterate that if you have insurance, connect with your primary care doctor, but there's a series of questions that you can start to ask. You know, what is colorectal cancer? Do I need to undergo a test? At what age should I start? You know, am I at a higher risk because I have X, Y, and Z? Or, you know, how can I get help to stop smoking? Those are things that you can ask a primary care doctor, and they can connect you with those services. So the type of test may vary based on where you're going to get assistance for screenings. So the main three types of ways to test for colorectal cancer is going to be colonoscopy, the fecal occult blood test, and the DNA FIT test. So with colonoscopy, that tends to be the traditional one that most people know. That's every 10 years and examines the rectum and the entire colon, where an instrument is placed through the rectum and it goes through the colon that you see here on the very left to be able to assess the polyp. So basically like cysts that or things that you see in the screen here that they'll be able to assess and examine to see if it's precancerous or cancer. There might be some complete bowel preparation before anesthesia is needed for this type of thing, and a biopsy can be performed as the polyp is removed. With the fecal occult blood test, these are going to be, there's two main types, which is the FOBT and also the FIT. So, you know, this is basically, you'll get like a type of cardboard where basically you go home, or you might do it there in the clinic, and basically after you poop, you'll be able to grab a little cardboard piece right here that you see. You'll be able to put it on the sample spaces right here, 1 and 2, and then you close it and then you turn it in. And this is something that you do not need bowel preparation for. You don't need anesthesia. It can be done every year. So this is where I say, because I know some of the places, I believe, for example, I know that some of the centers in Montgomery County, for example, I'm more familiar with Montgomery County, that's why I mention it. They do the fecal occult blood test as opposed to the colonoscopy. And so, you know, there's pros and cons to each one based on like what your signs and symptoms are, whatever your age is. But this is something that the average person can do. You know, the fecal occult blood test if you feel you might be at risk or having symptoms. But then we have the FIT test, which detects altered DNA in stool. It checks for altered DNA in the presence of blood. It's sampling that can be carried out at home, sometimes can be at the clinic as well. It can be done once every 3 years, and no bowel preparation is needed. So again, as mentioned, you can discuss this whether it is with your primary care doctor or at the centers that are doing the colorectal cancer screenings that are, again, no cost. They do have some requirements, you know, as like the other screenings, that you live in that county, meet the age requirements unless you have a letter of necessity. So is there any questions regarding colorectal cancer? And to answer the question, they can contact the facilities directly. We're just source of information. So basically, if they want to schedule an appointment, they can, if they have these numbers, we recommend them just call the clinic. They would just be calling us if, let's say, they don't know what number to call. Hopefully that makes sense. Okay, so there's no question about the cancer screenings. I do want to talk lastly about dialysis, and I know we also talk about dental. Again, it's pretty straightforward. So dental, I will be sending over a list to everybody about like the low cost dental services that are available across Maryland. Of course, remember that even with insurance, dental services can be expensive, but we will send you that list so that way you can get that information. But with dialysis, this is something that I worked pretty heavily on when I worked at a local hospital a couple years ago. And it's super common, especially with communities that are of low socioeconomic status. And that might be because of the lifestyle that they carry. I can tell you from my own experience that a lot of individuals who were in dialysis were low income. They did not speak English. Many of them may not have had immigration status, well, they didn't have immigration status, the ones I was working with. And so which is why we're here to talk about, how do you access that? So with dialysis, that is a treatment for end-stage renal disease that is needed. We're going to watch a very short clip about what is that, so that way we can best understand and explain what dialysis is. And then we're going to talk about, before we finish, how do you get assistance with dialysis if you do not have immigration status or you do not have insurance? Because there is an assistance that many people are unaware if you do not work in a clinical setting.
Good health makes a good life possible, and healthy kidneys are important to your overall health. Your kidneys filter waste out of your blood, so when they get damaged, waste can build up in your body and make you sick. Chronic kidney disease, or CKD, is when you have lasting damage to your kidneys that can get worse over time. If the damage is severe, your kidneys may stop working. This is called kidney failure, and it means you will need dialysis or a kidney transplant to live. If you have diabetes, high blood pressure, or a family history of CKD, ask your doctor to do a blood and urine test to measure how well your kidneys are working. Chronic kidney disease has 5 stages. The goal at each stage of CKD is to slow down damage to your kidneys and keep them working as long as possible. In the first 2 stages, you might not even know you have kidney disease. You might feel totally normal. At this stage, making healthy lifestyle choices and taking your medicines as prescribed can help prevent further damage. In stage 3, you have mild to moderate damage to your kidneys, and they aren't working as well as they should be. You might start to feel weak and tired, or have swelling in your hands and feet, or notice your urine looks foamy or darker than usual. With treatment and healthy lifestyle changes, many people in stage 3 do not move on to stage 4 or stage 5. To slow the progression of your disease, see your doctor regularly and talk about any changes to your labs or symptoms you're experiencing. Ask for a referral to a kidney doctor and meet with a renal dietitian. In stage 4 of CKD, your kidneys are moderately to severely damaged, and you might experience swelling in your hands and feet, or pain in your lower back, foamy or darker urine, or a change in how often you urinate. Stage 4 is the last stage before kidney failure. At this stage, it's important to work with your healthcare team to slow down kidney damage and plan ahead. Build a support network and learn about different treatment options. And stage 5 means your kidneys are about to or have already stopped working. At this stage, you'll need treatment like dialysis or a kidney transplant to prolong your life. Work with a kidney doctor to determine which treatment option is best for your lifestyle. The good news is, if caught early, there are steps you can take to slow or prevent damage to your kidneys, and living a healthy lifestyle will help you feel your best. Talk to your care provider about medications and lifestyle changes to support your kidney health. Get to know your kidneys at kidneyfund.org/knowyourkidneys.
Okay, so I always like to share that information regarding, what is actually, what actually leads up to dialysis. But with dialysis, we do experience a lot of individuals, who are undocumented or are not eligible for insurance, and they need dialysis, essentially to be able to survive. And so there's a couple things that we do that do happen in the clinical setting. And so in the clinical setting, especially if somebody is in need of dialysis, typically they present symptoms that typically lead them to the emergency room in a hospital. So this is where, in the hospital setting, where they can get that support for end-stage renal disease assistance if they're uninsured. When they go to the hospital, usually the process is for anybody who has no insurance, they'll collect their demographics just for everybody. And then if they're uninsured, if they are, I'll try not to jump myself. If they are in need of dialysis, it's the first time, they're more than likely to get admitted into the hospital. They'll go on to like the other floors, they'll be seen by a provider, etc. They'll get dialysis. Now, what happens after, right? Because they're being discharged, they're going home, but for people who need dialysis, each typically go 2 or 3 times a week to get dialysis. So these individuals are typically instructed to come back to the emergency room. Let's say they came on a Monday, and so we're going to count 2 days. Let's say the order is for them to come in 2 or 3 times a week. More than likely, what they're going to be instructed to do is, they're getting discharged on Monday. They just had their last dialysis. They're going to be told to come back on Wednesday to the emergency room and to, say that they need dialysis, etc. And they'll come Wednesday and then maybe Friday. The social worker, typically the social worker, because we're very fortunate here in Maryland to have a lot of social workers present in the clinical setting. In other states, they don't really have that. They basically will, either the social worker or this department within the hospital called DECO will help the individual apply for emergency Medicaid dialysis. There's 2 types of emergency Medicaid. There's emergency Medicaid, well, there was 3 before, but now there's 2, where we have emergency Medicaid for dialysis for only people who need dialysis. And then we have it for people who have been admitted to the hospital and are uninsured and do not and are eligible. I'll talk about that other one in just a moment, but we'll talk about dialysis first. So they'll be able to apply for so the DECO or the social worker or even the community health worker, they'll work with the provider to fill out this application. Is actually 4 pages long, or a little bit more, I think. It's about 4 pages long, and they fill it out. As you see here, they do include the demographics, and they also start putting down the lab work. So the laboratory test that you see here. So that's why it's needed for a provider to be able to fill it out. So not just anybody can fill this out. So that's why it's only done in a hospital setting, clinical setting like that. Then they'll also put here the order for the self-dialysis training, or if they are in need of kidney transplant, they'll put that information based on what stage of end-stage renal disease they're at, or they'll just put the order regarding like how frequently they have to come in. The physician will sign it, etc. DECO or the social worker or the community health worker will submit the application. It'll go to the state. In about 3 to 6 months after it has been submitted, more than likely, because it's almost always there. I've always seen it approved. I've never seen it not approved. If it wasn't approved, it's because it was missing a document. It gets approved, and then that patient will go to a designated a dialysis center that's close to where they live. So at that point, once it's approved, I know I was very excited to get that approval information, and then it was time for me to call the dialysis center on behalf of the patient, and I would schedule them. I would confirm with the patient, like, hey, is this location okay? Does that work? Then once that is good, basically they'll get an insurance card that is specifically just for dialysis. They do not get primary care. They don't get dental. They don't get anything else. It is just for dialysis and to see the specialist. That's about it. But it's really great either way. So then they go to that center. So instead of coming Monday, Wednesdays, and Fridays to the hospital, the emergency room to do dialysis, they'll go to the dialysis center that they now have been assigned. If they need to change the dialysis center because they have moved, then they just speak to the social worker or the personnel that's there at that dialysis center to transfer them to a different place. And so I want to pause there before I talk about the other emergency Medicaid. Is there any questions regarding dialysis in this process? I know it's a lot of information, so definitely you're more than welcome to reach out to me afterwards. But is there any questions regarding dialysis?
Yes, I'm sorry. I was trying to find the mute button. I'm so sorry. I have a question. So they apply for this in the hospital. And then you said 3 to 6 months it takes for processing?
Yes.
And then are they approved at the time of when the application was submitted or when it was approved?
So they do retro pay. So like, for example, yeah.
Okay.
Mhm.
I was gonna ask them, like, that's a lot of bills.
Yes.
That's
So yeah, so the patient at that point, they're instructed, they're like, hey, if you see any medical bills regarding your dialysis, ignore it, just keep it somewhere, just keep it. And then, once you get your insurance, if they don't do the retro-pay automatically, then you can submit a claim and you submit those documents. Now, if they were to, let's say, have gone to the let's say during this 6 months, they went to an emergency room on a Tuesday, but it was for something else that was not dialysis, then that bill they have to pay.
I see. No, yeah, that makes sense. So
Yeah.
only for dialysis
Only that.
purpose, they will get paid. Okay, got it.
Yeah.
Oh, good.
Yeah. So, and I was gonna say, and along with this application, the only responsibility the patient has is, well, a couple of the responsibilities that they have is, one, answer the phone when, the social worker, community health worker, whoever it is calling them, because sometimes we need additional information, to come to the dialysis appointments and to submit, all of those documents as soon as possible, because sometimes the delay is not just submitting the application, it's the delay is having the patient give us the documents to be able to submit it. So the sooner we can do it, ideally, in an ideal world, on the first time that they're coming in, they were admitted, that we can get it, all those documents and submit it. But sometimes it takes like a couple weeks for them to get it, all the documents in order, like proof of address, etc. So that way that the hospital can submit that application. And so if they do miss a dialysis appointment, they do have to get readmitted sometimes, because it just becomes so severe, the symptoms, and they could be at risk for further complications. So they'd get admitted, and it's better just to, be on top of just coming as instructed those days. And then well, I'll pause there. Is there any other questions regarding the dialysis? And sometimes it can become to the point where they may need a kidney transplant, or, and this is what I'm about to say is regarding all transplants. If there's some need of some type of organ transplant, some people have been denied because they don't have insurance, but because of now with this new legislation, the hope is that we will not have that issue, that people will no longer be turned away. Because I've had individuals that they're turned away by the hospital because they do not have insurance. And they were on the waiting list for like 4 or plus years for this one organ, and then the moment that they get a match and they don't have insurance, the hospital turns them away, and it's very unfortunate, because it's either like the hospital tells them you have to have the insurance or you have to pay it in full, and of course that's very impossible for a lot of people. So hopefully with this new legislation, we will see that barrier come to an end, regarding organ transplant. Also, now what I wanted to talk about, the other emergency Medicaid, is that when somebody is admitted to the hospital in the state of Maryland and they do not have insurance, regardless of immigration status, there's emergency Medicaid. So emergency Medicaid, the one in general, if you're admitted to the hospital and you're undocumented and are low income and you can prove all of that, basically, we will apply using an emergency Medicaid application. They'll submit it, and then it's possible that they can get those costs reduced. One second. So sorry. But those costs will be covered by emergency Medicaid. So sorry, allergy season and laryngitis, not a best combination, but as mentioned, so basically those who are admitted and they qualify for emergency Medicaid during their hospital stay, if they qualify, and that typically tends to be a little bit quicker than the 3-6 months. Usually we'll know within a day or so while they're admitted in a hospital if they qualify. And usually that's the holdup for like a surgery or a procedure to be done for that group. And basically, if it's covered, they don't have to pay anything. But it's possible they have to pay the emergency room. But that is emergency Medicaid, and that's also done in the hospital. But is there any questions regarding any of those type of things? Okay, so I know that's a lot of information, but don't worry, we will be typing that up for you in an email and a couple of documents. So that way everybody receives it in English and Spanish. But at any point in time, you are more than welcome to contact myself, and I'll put also the information. Um, Let me actually pull it up right now. You can contact me if you're a service provider. If you're a community member, you're more than welcome to also contact me if you have a question. Otherwise, what you can also do is on this link here, you can fill out the contact us box, and basically we would be able to reach out to you. Please include as much information as possible, such as where you live, and also what type of services you're looking for. So that way when we're calling you, we already know, you live in such and such county, and we can find this resource for you and share the list that we're talking about today, and be able to help you. And we're bilingual in English and Spanish. This is something that we do as a volunteer basis for those who have questions. And so if nobody has any other questions, I want to thank you for your time. I know we're almost at the mark, so you'll be able to get a couple minutes back into your schedule and your day. But I want to appreciate you, and all of this information will be uploaded to our YouTube page. And we hope to, especially next year, once we're getting closer to open enrollment, we'll do something similar to this, but more focus on the new legislation that those who are undocumented could purchase insurance. So we'll talk more about that next year. But I want to thank everybody for your time, and I look forward to seeing you in our other groups. And if you have any Spanish speakers who are interested in learning about all of this that we shared, we're going to have a session later today at 5:30. But thank you so much, everybody.